Cystotomy is most commonly performed to remove bladder stones in small animal surgery. A cystotomy is performed on the ventral side of the bladder. First, the bladder is isolated from the rest of the abdominal cavity with lap sponges and towels. 4 stay sutures will be placed. 1 will be placed at the apex, 1 at the level of the trigone, and then 1 on each side of the incision. The incision starts with an 11 blade and then will be extended with a pair of Metzenbaum scissors. Urine has to be aspirated as much as possible to prevent contamination. After the bladder is open, we're going to flush the bladder aggressively to get stones out. And also what we're going to do is collect a piece of the bladder wall for cultures. We're going to culture the stones and the bladder wall together and get an aerobic and anaerobic culture. Then we're going to flush retrograde the bladder and the urethra with a catheter that was placed before surgery. This way we can make sure that we have no stones left behind in the urethra if we flush aggressively. Then we're going to place a catheter from the bladder and to flush the urethra normal grade again very aggressively. We'll use the biggest catheter we can. Then the bladder is going to be closed with a simple continuous full thickness closure in a simple apposition pattern. We'll use a monofilament suture 4O with the quickly absorbed suture material. Each stitch are placed from 2 mm from each other, 2 mm from the edges of the incision. A 1-layer closure is sufficient for the bladder.